Awesome. Thank you for coming through to the platform, Glenda Gray. Um, you know, you've spent your whole life working in the hardest spaces of society, hospitals, HIV wards, public health crisis. What moment in your career shaped your sense of responsibility towards South Africa the most?
Well,
You could
I
just take us
trained.
back to your early
Yeah.
days and then
Okay, yeah. So I always wanted to be a doctor when I was growing up, and then when I started to do my clinical training at medical school, I started to realize that obviously this is the place where I wanted to be. And when I started to go through the pediatric wards, I realized that, in fact, I wanted to work with children. They resonated a lot with me. And when I started doing pediatric work at the Chris Hani Baragwanath Hospital, there was no such thing as HIV. It was before HIV even existed. And so I trained in a world without HIV. And as I was doing my training, slowly the tide turned, and suddenly, um, three out of one in every 10 women was HIV infected, and this changed to 3 women in 10 being HIV infected over a course of a few years. And then also when I was working in the pediatric department, suddenly, or it wasn't suddenly, but over a period of 2 years, we went to a place where many kids who were in my ward were HIV infected, and at some stage in the height of the pandemic, before the ARVs were available, literally every third child in our ward was HIV infected. And so what we saw in those early days was lots of death and dying, and young moms with young babies. And so this scarred me, and it made me want to try and find ways to reduce the toll or the burden that HIV was having on young women and children. And this deeply affected me. And so early on in my career, I started to do clinical research in the area of mother to child transmission in an attempt to try and mitigate the HIV epidemic, and to try and prevent pediatric HIV infection. And so that's what's driven me in my career, in my research career. I didn't think I would be a scientist. I thought I would spend most of my life in a ward at the Baragwanath Hospital, in looking after children and training young doctors. But life takes a turn, and I responded to the HIV epidemic by getting involved in clinical research. So that's what kind of marked my passage from a pediatrician to a clinician scientist to someone dedicated to try and find ways of getting back to that place that I started my career when there was no HIV.
you've said on your previous interviews, our health workers are among the courageous human beings. From what you see on your standpoint today, are they surviving the system or still believing in it? Most preferably, we will talk about, nurses, but just all the health workers in general.
Yeah, it's very hard to be a nurse in South Africa. And it's very hard to be a nurse in the public sector in South Africa because you're overworked, and you don't have the kind of facilities or infrastructure that you deserve to deliver your care. So I have a tremendous compassion for nurses and other healthcare workers, but especially for the nurses, because basically they bear the burden of looking after patients in the wards or in the clinics. And so I can understand their burnout, I can understand their frustration, and what really moves me is that they that they committed, despite the work that they face and despite the system, is that they show up and they try and make a difference. And so I respect their how courageous they are and how brave they are.
You've also argued the country should double or triple research funding. What does a nation risk when it underfunds its own scientific thinking?
Well, a nation that underfunds science is a nation that's never going to thrive. And there's a direct correlation between investing in science and technology and GDP or economic growth. And countries who understood this connection, like South Korea, like Singapore, like China, um, understood that this was critical for the economic growth and going from a poor country to a rich country. And so in South Africa or in Africa, we often think that science is a luxury, but for poor people, science is a necessity because that's the only way that's going to drive our economic growth. It's only if we're investing in science, investing in technology, do we grow and improve our economy. And so I think not understanding that means that we will be poor forever.
Now let's talk about, during the pandemic, there was misinformation spreading rapidly, and obviously there was a bit of altercation between you and the president of the country, Cyril. And I want to know your perspective on, is disrupt in science mainly an educational problem or leadership problem? And also just tell us more about that altercation that has occurred between you and the president, and why was it such an important issue to actually deliberate and send out for actually South Africans to actually hear these stories and understand the whole picture that was happening during that period.
Sure. So my altercation was mostly with the Minister of Health um, around issues around malnutrition. So the biggest issue that I had was that pediatricians told me that they were seeing an increase in children coming to the hospital who were malnourished. And this made sense because we were into a hard lockdown, and so people were struggling with money. And if you were formula feeding your baby and your baby is 6 weeks old, it doesn't take months for a child to become malnourished. It's a matter of weeks. And so I was concerned as a pediatrician that there was this was an early warning sign that there was going to be issues with malnourished children. And so that was the reason why I had one of the altercations. And the other altercations was about the regulations that didn't make sense, like open toe shoes and things that made no sense to prevent transmission of SARS-CoV-2. So I spoke out against some of the regulations, and I spoke out because I was concerned with children and them being malnourished. And over the course of the COVID pandemic, we did see, in other parts of the country, reports of children being malnourished, like in the Eastern Cape. There was some reports as well. So the issue of malnourishment was something that concerned me during the pandemic. I guess because I'm a pediatrician, and I don't like the idea of children going hungry or not having food. And we saw that was also a big problem for school-going children who relied on food being given to them at school, and now this was no longer available to them. So not only did babies become malnourished, but young children starved, which was for me very painful. So so I think those are the issues that that are raised. I also understand from a government's perspective because they're following a line to target lockdown, and and they didn't want people questioning the lockdown because they that was their policy, and that was the strategy they were using to try and contain the pandemic. So I can understand from their side why they were concerned about a scientist speaking out. And from my side, hopefully they can also see that I was also concerned about children starving.
You've dedicated decades to the search for the vaccine. What convinced you that the breakthrough will come?
Well, the HIV is the hardest virus we have ever been exposed to, and it's going to be the most difficult vaccine to make. So it's the biggest challenge at a global level. And so I'm attracted to finding an HIV vaccine because it's the greatest challenge a scientist has. And it's our job as scientists to try and contribute to understanding the virus itself and trying to figure out how to outwit the virus by making a vaccine that attacks it, and as we have been unable to do. And so HIV is tricky. One, because no one's been naturally cured from HIV, so we don't really know what protects, what we have to do in our immune system to protect against HIV. We also know that HIV replicates rapidly all the time, and so it's ever changing. And so when we are trying to find a vaccine, we have to try and aim at parts of the envelope of the virus that don't change, and that's hard. There's all these difficult things about how to design a vaccine that make it incredibly challenging and incredibly exciting. And so the reason why I work on HIV vaccines is because I believe the only way we can really control this pandemic, and the only way we can move towards an AIDS-free generation again is with a vaccine. We know that vaccines are powerful tools to contain epidemics or pandemics. And if we didn't have a smallpox vaccine or a measles vaccine or a polio vaccine, we wouldn't have been able to control these infections. And so I believe that an HIV vaccine is going to be critical to stop HIV in the future.
The University of KwaZulu-Natal recently, I think it was last year, I think I've seen like a clip or just a WhatsApp status from someone posting, one of the people I was schooling with last year, and and I did a bit of research. It actually recently reported a breakthrough where there was actually 20% of trial participants who could live without daily ARVs. With these cure milestones happening in Durban, do you feel the global focus and funding is shifting away from the preventative vaccine you spent your whole life chasing? And is a vaccine still a cure now more realistic for South Africa?
So I believe that a vaccine can work for prevention and for therapy. So I believe vaccines will play a role in what we call therapeutic vaccines. And so we still don't know. So there are people that when you give them a vaccine or a neutralizing and a monoclonal antibody that can neutralize HIV, and you do a analytical treatment interruption, like what happened in KwaZulu-Natal, there are some people who are able to control their virus, and the others that rebound. We don't know how long those people who are able to control their virus will control it for, or eventually if they will have to go back onto treatment. But those people are very important because they give us a window into what parts of the immune system, what the immune system is doing to control the virus. So they're very important. So those people are what we call they have like a functional cure, but it doesn't mean that they've eradicated the virus or eliminated it, or they completely cured. So hopefully those individuals that are controlled of their treatment will remain controlled, so that we can study them to help us make vaccines. They're very important for us to understand what the immune system is doing to control HIV. But what we need to cure HIV is probably a combination strategy where we need both vaccines, these monoclonal antibodies that I talk about, and other strategies to get HIV out of the reservoirs. Because what happens is, even though you might not be able to see HIV replicating in your blood, there are reservoirs in our body, in our brain, in our bone marrow, in our lymph nodes where HIV is nascent or resting, and we have to get to those parts of those reservoirs to get HIV out, and that's an important strategy. So I do believe that hopefully one day we'll be able to cure HIV, and there's a lot of work being done on that, and that's important. And I believe that the vaccines we're working on can also work to support a functional cure. And so the work that we do with vaccines, we work both in people living with HIV, and we work in people who are not infected, to try and understand, what our vaccine can do in both areas. And people who are living with HIV provide a very important insight, because they have been exposed to HIV. You give them the vaccine or the monoclonal antibody, and then you withdraw treatment, and you see what happens to the virus and what happens with the immune system. So I think that both things are important, and that a vaccine can be both therapeutic and preventative. So we will always need, we won't, hopefully there'll be a time when we can reach everyone. Once we have a cure, we can reach anyone who is infected and cure them. But until we reach everyone, there will still be transmission, and people will still get HIV. So that's also why we need a preventative vaccine. I hope I made sense there.
Yeah, most definitely. Two more questions. The Brilliant Consortium aims for African discovered and African-made vaccine. Why is local ownership of science so important for dignity and independence?
It's very important. We don't do enough science on our continent, and we don't invest in enough science. And for us to try and grow an area of science that's local is important for our dignity and for our investment in the future. And so the Brilliant Consortium is a pan-African consortium where we build capacity both in the clinic and in the laboratory to understand HIV on our continent, and to try and find design local vaccines that will work against our strains. So in Africa, we have circulating strains of HIV that are different to North America or Europe, and we also have genetic diversity. We have huge genetic diversity on this continent, and so genetic diversity also drives your immune response. And so we can't assume that our immune responses are the same as a white male in North America. And so it's very important for us to evaluate vaccines in our populations so that we can understand our immune responses, because that's going to be critical. And we also need to look at local strains of HIV when we design our vaccines so that it can protect against the circulating strains on our continent. So I think there's biological reasons why we need to do this work in Africa, and there's scientific reasons why we need to do this work. And it also creates for me an area that we can grow and make sure that our young scientists themselves um, are eager to follow this field going forward.
You know, personally, I look at you as one of the most top-tier academic achievers in our generation. And it's truly an honor, really, to have you in this platform and to obviously build credibility, but also just to also share um, for what you've achieved as, Glenda Gray. And I'm obviously one of the most biggest critics of the educational system, but I know it has its flaws and it has its own rights, but we should also celebrate, you know, um, institutional education, of course, because of its breakthroughs in research and how also PhDs can also have an impact, not just PhDs to sit on the shelves and just be used for recognition. One of the most difficult things we have in this generation, because when you look at the previous years, everyone is looking at the medical doctors, the pharmacists, as the medical sphere had to be the career that if you pivot in and you succeed in obtaining qualifications, you're going to say, gents have made it, and which realistically now it's not the case, pharmacists are striking online. You see it in News 24, you see it everywhere now. Doctors are striking. I haven't been unemployed. I've been unemployed for the past 5 years. It's happening everywhere now. And I want to get your perspective of how we could actually fix that now and how we can actually try and come up with solutions and programs that, because I was actually thinking about this concept of where not only we're using stats as say just to provide um, graphs of how many doctors are employed, how many doctors are, all those data of dead crisis, just the graph. But now, if we're gonna be using these data sciences to come up with solutions that are just showing the frequencies. For example, if you're connecting principals in high schools and you're connecting students and you're connecting the stats essay, so the students who are applying for the university programs or university studies, they are applying to jobs that have the direct correlation in terms of employment rates. So stats essay will tell you that in the past 5 years, there have been job applications that have been opened for pharmacists, for mining engineers at this rate. So the possibilities, when you're checking the charts, in 2027, in 2028, there's going to be there's going to be so many people who will realistically get job at this amount. So now realistically we know that if I'm going to be looking to get a job in a pharmaceutical department in 2028, or I'll graduate in 2028, just looking at the market and how it's going to be moving. These are how many people who I have 10 to 15% chance of getting employed. But if I'm looking at another department, there's a chance for me to be employed in the specific rates. Obviously, I was talking to Teboho Mashafili, one of the Mashafili, one of the head of departments of UJ chemical engineering sphere, also talking about skills development of how we can actually now start to derail this whole facade of academic achievers in terms of their rights of just obtaining these cool certificates and degrees. But let's now look at how we can provide programs. This is a business idea, by the way, and I was just looking at this is a business idea. And if the government now can actually use this strategy to draw real employment into to draw the younger generation into the economy, I think it's a big miss. I want to hear your thoughts on how we could shift that, and maybe is it, in your own perspective, is it this is a solution, or is there a solution that you're currently having with your council and your department at this?
Yeah. I mean, you raise an important thing, so are we training people at university, are they fit for purpose? Or are our universities fit for purpose? When we train someone at university, are they ready for the job market? And are they skilled enough to be in the job market? And so I think that's the first problem, is that we may not be training people to be fit for purpose and that they'll be able to get a job. And so we need to look at the way we train people, and we also need to look at what's missing in the country and make sure that we train people in that area. So that's one aspect of it. The second aspect is, the tax man, SARS, collects trillions of rands. And if we managed our money properly, we would be having a thriving economy. If we didn't waste money with corruption, and you've seen the stuff that happened at Tembisa, all of that money could have gone to employ doctors and nurses and pharmacists. So there is a shortage of we know that the healthcare workers, there's not enough. The wards are full. The hospitals are busy. We can't do we have to cancel surgery because our theatres aren't working properly. We don't have enough cardiologists. And so if we used our money properly, we could have a wonderful health system, if there was no corruption. I mean, we hear in Eastern Cape just now that I think R1 billion worth of medicines haven't been paid, which means that patients, the pharmaceutical companies will stop giving Eastern Cape drugs, which means people will die without their drugs. And so for me, I feel if we managed our money properly and we got rid of corruption, one, we'd have a health system that works properly, and we could also use our money to make sure that we are skilling people to get jobs. We need more engineers. We need more technical experts. And if we want to be a thriving economy, we have to make sure that our students are poised to contribute to the thriving economy. And we have to make sure that our graduates are skilled enough to get jobs. And we also have to make sure that we are creating jobs for people to go into. So I think it's for me, it's all about we waste money in our country, and if we didn't waste money, people would have jobs and we would be thriving.
Thank you so much, Glenda, for coming through to the platform.
Thanks.